And the next participant, number 5, is Dr. Devesh Desai. Devesh is again a very close associate, has been very avid in the education circuit. If you see his hobbies, he is a black belt in martial arts, compulsive gym goer, and a dancer. And Devesh, I feel very happy to tell you this, that if you and I exercise for the same duration, at the same intensity, I will burn more calories than you because of my body weight. So it is.
But you have to work with same intensity.
Yeah, I said that.
Hello. A few hobbies he did not write. I don't know for what, but
He had many other things, but we did not have space. That was the only reason.
There was the last line that it mentioned that I have learned everything except as on yet flying an aircraft, ship, and train.
Okay, yeah. Very humbly, he says that he's never flown an aircraft, and we really regret that, and I hope you rectify that very soon.
No, I am retired.
Yeah. Devesh has chosen pharmacotherapy of diabetes as his chosen subject, and your timer will start now. Which of these two causes a greater reduction in HbA1c, metformin or sitagliptin?
Metformin.
Correct. Insulin lispro, insulin aspart, and insulin glulysin are all types of what?
Analogs, fast acting.
Correct.
Rapid.
Chances of which metabolic complication increases if metformin is used in patients with high creatinine?
Acidosis, lactic acidosis.
Correct. You will be happy seeing a urine sugar of 4 plus in a diabetic patient receiving which drug?
Gliflozin.
I'll give it to you. Which group of oral antidiabetics may be used in type 1 diabetes, especially to reduce postprandial sugar?
Repeat.
Which group of oral antidiabetic drugs may be used in type 1 diabetes, especially to reduce postprandial sugars?
Acarbose.
Correct. If a type 2 diabetic is to be started on insulin, which type of insulin is initially recommended?
Basal.
Correct. The brand names Galvus and Jalra, which contain gliptin, are in 50 milligram per day, twice a day. What is the content?
Vildagliptin.
Correct. Which oral antidiabetic drug possesses the best evidence of coronary heart disease risk reduction amongst all antidiabetic drugs?
Repeat.
Which oral antidiabetic drug possesses the best evidence for reduction in coronary heart disease incidence?
Pass.
Which diabetes drug raises HDL cholesterol, improves NASH but worsens cardiac failure?
Pioglitazone, rosiglitazone.
Correct. I'll give it to you. There are currently 5 US FDA approved drugs for weight loss. One of them is an anti-diabetic drug. Which?
Liraglutide.
Correct. Name one insulin secretagogue that is to be given with each meal and is safe in patients with high creatinine. One secretagogue with each meal.
Magnetite.
I will get you. Metiglinide. Correct. Linezolid is sometimes used for cellulitis in diabetes. What adverse reaction of linezolid is dose dependent and occurs frequently if given for more than 2 weeks?
Steven Johnson.
Incorrect. What is the dosing frequency of the brand Biduron containing exenatide and the brand Trulicity containing dulaglutide?
Once in a week.
Correct.
0.6 milligram per kg.
Correct. Diabetologists often manage to prescribe the maximum dose of Voglibose, which is 0.3 milligram TDS, but almost never reach the maximum dose of acarbose, which is what? Maximum dose of acarbose is what?
100 milligram.
Specifically. Per
mil.
Per meal is correct.
Yes.
I'll give it to you. Saroglitazar, brand name Lipaglyn, is approved only in India. Which lipid abnormality in diabetes does it address? Saroglitazar addresses which lipid abnormality?
HDL?
Incorrect. We finish your round. 12 correct out of 15. The ones that were given incorrectly or little differently, you will be happy to see a urine sugar of 4 plus in a diabetic patient receiving any SGLT2 inhibitor. Like
That
you
I
said,
said.
we gave it to you. Canagliflozin. Which oral anti-diabetic drug possesses the best evidence for coronary heart disease prevention? That is metformin.
Metformin. Yeah. Last one.
The three insulin secretagogues of the gleaned group are metiglenide, which you said, ripaglenide and natiglenide. Linezolid after 2 weeks can cause thrombocytopenia, and saroglitazar or lipaglyn is reduces triglycerides. Correct.
Oh, right.
Okay, your score again is 12, and which means that you need about similar score for the second set to have a chance to qualify. Let's have the countdown, please. CDC USA recommends how many minutes of moderate intensity exercise per week to an adult?
150 minutes.
Correct. Capsule endoscopy has a greater role in which of the two? Crohn's disease or ulcerative colitis?
Ulcerative colitis.
Incorrect. Between hepatitis A, B, C and E, which viral hepatitis has the highest chance of chronicity?
E.
Incorrect. A higher dose of warfarin and hence a higher PT-INR will be required in which patient? A patient of DVT with pulmonary embolism or a metallic prosthetic valve patient?
Pass.
In dextromethorphan, if dextromethorphan is a cough suppressant, guaifenesin is an expectorant, what type of an agent is ambroxol?
Phenylpropylen.
Which complication due to passage of gallstones causes elevation of bilirubin, GGTP and alkaline phosphatase? Which complication?
Cholecystasis.
Incorrect. In a patient with chronic renal failure, with which commercial preparation is a better supplement? Shelcal M or Shelcal OS?
OS.
Correct. In interstitial lung disease terminology, if IPF stands for idiopathic pulmonary fibrosis, what does UIP stand for?
Pass.
What group of drugs used in depression paradoxically cause an increased risk of suicide?
Benzodiazepine.
Incorrect. 70% of males more than 80 years of age will be harboring which cancer?
Prostate.
Correct. The phenomenon of ineffective erythropoiesis in vitamin B12 deficiency leads to which abnormality in the liver function tests? Ineffective erythropoiesis due to B12 deficiency causes which abnormality in the liver function tests?
Pass.
In which disease is fluticasone aerosol swallowed, not inhaled?
Reflux.
Incorrect. Lactobacilli are an example of probiotics. Give an example of a commercial prebiotic preparation.
Pass.
This is a true or false question. Candida albicans is a part of the normal flora of oral cavity. True or false?
True.
Correct. Sacroileitis, uveitis, erythema nodosum can be extra-intestinal manifestations of which GI disease?
Ulcerative colitis.
Correct. Is that fourth? A higher dose of warfarin is required in which patient? DVT with pulmonary embolism or a patient with metallic prosthetic valve? Is correct. Next. In interstitial lung disease, IPF is idiopathic pulmonary fibrosis. What is UIP?
Pass.
The phenomenon of ineffective erythropoiesis in B12 deficiency leads to which abnormality in the liver function test report?
Acidity.
Is incorrect. We have 6 correct questions, Devesh, and your total is 18. The question that which you did not get is which viral hepatitis has the highest chance of chronicity? C. What type of an agent is ambroxol? Mucolytic.
What kind of?
What complication of gallstones causes high bilirubin, alkaline phosphatase and GGTP? Acute cholangitis and or CBD obstruction.
Stasis I said, no?
Stasis I would not give because it can be too many things. UIP stands for usual interstitial pneumonia. Which antidepressant causes increased risk of suicide? SSRIs, the SSRI group. And on liver function test, B12 deficiency can cause high indirect hyperbilirubinemia. Fluticasone is swallowed, not inhaled, in eosinophilic GI disease. Example of commercial prebiotic preparation. Lactulose is a prebiotic. And yeah, that was all. Thank you, Devesh.